Trial process breakdown. Baseline assessment. At the baseline assessment, appointment 1, we will ask that you answer any trial-specific questions a potential participant may have. If the participant is happy to continue, you should then go through the informed consent process as detailed in the earlier slide. Once consent is taken and verified, you will then need to complete the baseline data collection, including demographic information with the participant, entering all the relevant details onto the trial database. Please indicate yes or no on the trial database whether the participant has consented to take part in the qualitative sub-study interviews. You will also need to ask the participant to complete the following questionnaire during this appointment: the Asthma Control Questionnaire ACQ5. Please note, due to licensing issues, this is a paper form only, and data needs to be entered onto the trial database by staff directly following the appointment. Links to the following questionnaires will be sent to the participants to complete following consent verification on REDCap: the EQ5D5L, the Health Economic Resource Use Questionnaire, and the patient's employment and income status. Randomization. Following the baseline data collection, GP or staff will then randomize patients via the study database. Participants will be randomized to either the standard care arm, which is salbutamol plus low-dose inhaled corticosteroids, or the intervention arm, the combined inhaler formoterol plus inhaled corticosteroids and low-dose inhaled corticosteroids. Post-randomization. Trial participants will be in the trial for 12 months post-randomization. All trial medications to be prescribed by their GP. The trial participants will undergo several follow-ups during their time in the trial. However, participants are free to withdraw at any time without giving an explanation. Qualitative sub-study procedure. Healthcare professionals. The qualitative team will contact healthcare professionals directly to see if they are interested in participating in the qualitative interviews. Interested healthcare professionals will be given a participant information sheet by the qualitative study team, and an appointment for the interviews will be arranged. Trial participants. If a participant ticks yes on the consent form to show interest in participating in the qualitative interviews, we will need to indicate this on the trial database following consent. Interested participants will then be contacted directly by the qualitative team at the University of Nottingham. Follow-up assessments. Month 1. Participants will need to be seen or contacted by telephone at month 1, appointment 2, and you will need to complete the 1-month follow-up questionnaire on the database with them. Months 2 through to 11. Participants will receive a monthly automated text message asking if they've had a severe asthma attack needing 3 or more consecutive days of systemic corticosteroids. These will be predominantly prednisolone. Participants are asked to reply yes or no. You will follow up the yes replies with a phone call where you will ask the participant questions from the follow-up form provided on the trial database. Months 3, 6 and 9. Participants will be asked by text or email to complete the EQ5D5L and the Health Economics Resource Use Questionnaire via a link to the database. Please note that participants should be sent a paper copy of each questionnaire on request only. Also, reminder text and/or emails will be sent when participants do not respond to initial text inquiries or complete their questionnaire data within the required period at each time point. Follow-up assessments continued. Month 6 compliance check. GP staff will need to review the previous 6 months medical records to retrieve the type and number of all asthma inhalers prescribed and enter these details onto the trial database. Month 12 assessments. Prior to the patient consultation, GP staff will need to review the previous 12 months medical records to confirm self-reported systemic corticosteroid use, which will be predominantly prednisolone. Please identify any unreported courses of corticosteroids and retrieve the type and number of all asthma inhalers prescribed using the form on the trial database. Please note, a report will be generated from the trial database to help with these comparison checks. Patient consultation. At the 12-month end of trial assessment, which should ideally be a face-to-face appointment, please ask participants to complete the ACQ5 on paper and the EQ5D5L and the final Health Economic Resource Use Questionnaire, if not already completed. Both of these are online. Ask them to complete these in a quiet area of the GP clinic before their consultation. GP staff will need to inquire about any discrepancies identified during the comparison checks with the participant using the queries on the form on the trial database. Retention. Retention is just as important as recruitment. Ways you can help us improve and maintain retention. Ensure participants are aware of the importance of us collecting follow-up data, completing questionnaires and attending clinic appointments. Explain processes clearly to them. Ensure correct contact details are recorded.